Good morning and welcome. I want to thank all of you for joining us here this morning as we unveil a very unique autism awareness campaign that we're conducting with the MBTA. We appreciate your making the effort to come through the weather and the puddles and the floods, so thank you. I'm Heidi Howard. I'm a Chief of Business Development with May Institute. May Institute was founded 55 years ago by parents of twin sons with autism. Since that time, our organization has evolved, and we're now one of the largest nonprofit organizations in Massachusetts. Today, we serve about 25,000 individuals with autism and other special needs each year, and provide evidence-based services to families and communities across this state and the nation. As many of you know, autism is a very complex disorder, and the journey of families who have a child with autism is also complex. It's one that is filled with both challenges and joys. It is a journey that many families undertake. The latest statistics from the CDC indicate that 1 out of every 110 children have autism, and 1 out of every 70 boys are affected by autism. Here in Massachusetts, about 11,000 school-aged children have a diagnosis of autism spectrum disorder. And that number the prevalence rate has increased by 50% over the last 5 years. There's a lot that we don't know about autism. We don't know its cause. We don't yet know its cure. But we do know one very powerful fact, and that is that early diagnosis followed by effective treatment can have a very profound impact on the lives of children with autism. And we are, as we kind of look around here today and we look at the stats, it's very unlikely that the majority of people who are passing through this station today are not touched in some way by autism, either directly or indirectly, through a member of their immediate or extended family, or that of one of their colleagues or friends. Over 1.3 million commuters use the subway and T station each day, and it is our hope and intention that by presenting this autism awareness campaign and education about facts about autism, we will be able to affect and positively have an impact, a meaningful impact on the lives of children with autism by encouraging families to seek early identification and early intervention. We are very grateful and pleased for the families who have helped us to produce this campaign. Many of them are here today, and they have been extremely generous in sharing their stories, their personal insights, and in giving us support and encouragement as we have conducted this campaign and put it together over the course of the last 2 years. So we're very grateful and want to thank them. We are also very pleased to honor and acknowledge the lovely faces of the children who you will see on this campaign, highlighted on this campaign. And these children are James, Dawson, Alexandria, Mwede, Michelle, Austin, Anna, and Brooke. We are honored for their participation in our efforts to raise awareness about autism. In closing, I would just like to ask everybody here to look out for the Autism Awareness Campaign over the month of April as you're traveling to and fro from work and for pleasure. Seek out these children and their stories, find out facts about autism, and really become an advocate for the early identification and effective treatment of autism. Thank you again for coming. Thank you. Now it is my pleasure to introduce Mr. Richard Davey, who is the General Manager for the MBTA and the Rail and Transit Administrator for the Massachusetts Department of Transportation. Mr. Davey.
Thank you. Thank you, Heidi. Well, first of all, as the new general manager of the MBTA, I can tell you that when asked if I wanted to participate in this event, I said absolutely. I was a spectator last year, and I'm pleased to be representing the MBTA on this very important partnership in this project. I was saying earlier that we at the T, and I've been on the job for a week, I don't get as much opportunity to talk about the good things that we do at the T as much as I would like. And this is a good thing. We are most pleased to be partnering with the May Institute to launch this public campaign to make sure that kids are diagnosed early and that they can get appropriate treatment. I'm looking forward to visiting the May Institute, which is located in my hometown where I grew up, in Randolph. But this is a terrific opportunity for the MBTA to help the community, to bring more public outreach and more education to what autism is. And I know with the beautiful pictures of these kids in our buses, our trains, and our subway cars, people will look, people will think, and I hope it will lead to early diagnosis. So thank you to the families for offering your kids to assist. And again, I can't be more pleased to be here today and to support the May Institute. Thank you so much.
Next, it's my honor to introduce Representative Barbara L'Italienne. She is a Massachusetts State Representative. She is the Vice Chair of the House Ways and Means Committee. And Representative L'Italienne is also a tremendous and tireless advocate for families with special needs in our state. Representative Barbara L'Italienne.
Good morning, everybody. I am an advocate for folks with special needs, absolutely, but obviously near and dearest to my heart is the autism spectrum because I am a parent of a child on the autism spectrum. I have a 19-year-old son named Rudy, and so I'm walking in the same shoes as all of you sitting here today. I am really thrilled to be here. I'm so glad that we are partnering with LoJack and with the MBTA, and you all know the great work that the May Institute does. As Heidi mentioned, the incidence rate in Massachusetts is only growing. We think it's about 1 in 100 children, school-age children at this point. The issues are not going away, and having a partner to try to make sure that awareness is there, early detection is there, is critically important. I'm hoping, with a little bit of luck today, that I'm actually going to have a bill passed in the legislature that will establish an autism commission. And the hope is that we will bring together state officials that run the state agencies, advocates, professionals, parents, teachers, anyone who may intersect within the life of a child or an adult on the autism spectrum. It's not going to be segmented out by age, it's going to be the entire spectrum. And as we all know, it's a wide range of abilities, and it's going to be the entire age span because, quite frankly, we need to stop looking in terms of little segments of who we are going to deal with and who we're not going to deal with. So it's my sincere hope that this is going to pass today, and we will begin setting about the hard work of looking at all of the different lifespan issues that children and adults on the autism spectrum have to deal with. And as you know, times are tough right now, money is really tight, but that should never stop us from planning and figuring out what our long-term vision needs to be. We all know that this is a lifelong challenge, and so we need to really do our best to help address it as early as possible, ideally, but we also have generations of folks that didn't have that benefit that also need our support. So I'm very pleased to be part of this day. I'm looking forward to maybe meeting and talking with the parents, or if any of the children are here. The pictures are absolutely beautiful, and so I'm really pleased and proud to be with you today. Thank you so much.